ThermiTite of the abdomen. So there are a lot of patients out there who have a little bit of excess stretched out skin of their abdomen, but not bad enough for a tummy tuck. And the only thing we can do between a tummy tuck and nothing would be to perform a non-surgical or non-excisional skin tightening procedure. Basically, what we want to do is tighten up the skin without having to cut out the extra skin, because cutting out the extra skin means we need a scar. In other words, we need a seam to cut out the extra fabric. And in plastic surgery, those seams are scars. So the only thing we can try to do if we don't want to cut out the extra skin is try to tighten up the skin that's already there, sort of shrink wrap the skin that's there so that the loose skin becomes tighter. And one of the devices we use to do that is called the ThermiTite. What the ThermiTite does is it takes a probe, which is a long needle, and it heats up the skin from underneath it, which is the dermal side of the skin. And what we want to tighten up the skin is we need to tighten up the dermis layer, which is the thick part of the skin. So this probe heats up the dermis from underneath, from the bottom side, and I watch it with a camera on the outside, and the camera tells me that I've gotten your dermis hot enough to tighten up, but not so hot that I create a burn, which would create a scar. So that's basically what the ThermiTite is. We numb up the area, I pass this probe underneath the skin, I watch your skin on a special camera that tells me how hot it is. I get it hot enough that it should have a clinical effect of tightening up, but not so hot that you have a burn. One thing to keep in mind is if you want a more reliable result, an excisional procedure such as a tummy tuck is always more reliable and predictable. When you do these non-invasive skin tightening devices or procedures such as ThermiTite, they do work, but they're not as reliable as a skin excision procedure. So keep that in mind. In order for the ThermiTite to work, the skin has to have good elasticity. So if your skin is very thin and it has stretch marks, ThermiTite will not work. If you have younger skin, which is nice and thick and elastic, and you have no stretch marks, ThermiTite may be a good option for you. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.